Hi, everyone. I'm Lisa with IVF Manifesting a Miracle. And for today's Soul Sister conversation, you're in for a treat. You're going to get to meet my friend Donna. This is Donna Seegers Abler. Hi, Donna.
Hello. So good to be here with you, Lisa.
Yes, thank you. And you live in Wisconsin
Yes.
and a fellow occupational therapist and
Mm.
a holistic health practitioner, energy healer. You do pregnancy and newborn coaching and prenatal and perinatal psychology educator. You do a lot of things.
Yeah, yeah.
It's an honor
It's
to be
been,
connected with you.
yeah, it's an honor to be here with you. I'm so excited and I love that we share a very similar passion and supporting women in this pregnancy journey.
Yes, I know. And you're a soon to be author as well, releasing a book
Yes.
coming up.
Yeah, I'm excited. I'm in the home stretch. My book is at the printers and we're just waiting for that initial printer's proof to come home and get the price set and get it
Yeah,
launched. So we're getting
love
close.
me in, and we'll get into that too in a little bit. But
Yeah.
I reached out to you for a Soul Sister talk because you and I both understand the importance of helping women with the mental, the emotional, the spiritual, their spiritual health as they go about their journey to motherhood, from
Right.
pre-pregnancy, during pregnancy, and after pregnancy, and really understand the importance. This is a spiritual journey. A lot of women that I see in the fertility community, it's this medical process, with
Right.
with the treatments, the shots, the hormones, the appointments. And where you and I are aligned is really tuning inward, helping women kind of journey home to themselves and journey within, looking
Mm.
at how they can support their little one, which I love that you help women, in that pregnancy stage to carry over those strategies.
Yeah, and it's been so exciting for me, Lisa, to really take my professional career of occupational therapy and be able to blend that and combine that with this spiritual path, and just the
Yeah.
power of that has really been
I
exciting for me.
agree. I mean, it's interesting. I think you probably started out as an OT as well, an occupational therapist, and
Yeah.
how our journeys have led to the work that we're doing now. And can you share a little bit of your background and kind of how you got into the coaching work that you're doing now and the energy work?
Yeah, it's interesting. I was just reflecting on that a little bit with my birthday coming up, April 1st. So I'm this
Oh,
April Fool's baby.
ah.
But my journey really started with that. It started in utero, and for whatever reason, I came into this life with a lot of awareness of my own in utero experience and my experience of my birth and how that set me up. So I was born in the early 60s, and the birthing industry was very different then. Moms just didn't have the same support. It wasn't as easy to even talk about pregnancy and birth at that time, and certainly not infertility. Dads weren't allowed into the birth room at all for delivery. And I remember my mom talking about, getting this hypo or this shot. Like, she didn't even really know what the procedure was or what was given
Mhm.
to her. And yet it kind of put women in this twilight sleep, and they just weren't really very conscious and present for the delivery of their baby. And so, my birth experience had that piece.
Mhm.
And it also had, just the piece of my mom's overwhelm and how that imprinted into me. And she had two young children at home. I was the third child, and my brother was only 12 and a half months older than me. So she was raising a baby and being pregnant at the same time. So just a lot of imprint of overwhelm into me as I
Mhm.
was in her womb environment. So those were two really impactful experiences for me in this life. And then, of course, she shares my birth story on my birthday every year as I was growing up. And she would talk about how she went into labor in March, and it was premature labor, and they sent her home, and the inconvenience of that. And then she always said, I didn't care when you were born, but I didn't want an April Fool's baby. And so, of course, here I am, on April Fool's. But but all of that is that mental, emotional, and spiritual aspect of pregnancy. And all of those imprints set me up with, well, did I do something wrong? Did I come on the wrong day?
Hmm.
Am I supposed to be here? And we can struggle with that, of these deep mindsets and imprints of, did I fail? Am I worthy? I'm going to be abandoned? So it just, that set me up on my journey, of
Yeah.
finding this path with this deep work around emotional and mental and spiritual help with pregnant moms. So
This
it
is such
really
important
comes,
work.
yeah, it comes from a lived experience from me, more so, than what I learned through a school of thought or
Yeah.
knowledge or information. So I'm very passionate about it.
I love it. And it just helps women who are going through, want to become a mother, just to understand the importance of the maternal well-being. It really
Right.
starts with us. And
Yeah.
for
Yeah.
you too, I mean, was it through your mom sharing those stories that also had an imprint? I mean, or do you think through her thoughts and maybe her stress that
Yeah.
imprinted on you in
Right.
home? I mean, who knows? I don't know.
Yeah. Yeah. It's probably as a both and
Yeah.
I have a lot of compassion for my mom. I appreciate that
Mhm.
she could share as much as she knew about her story. And, it's not to set pregnant moms up for stress of, oh my gosh, am I being positive enough? Am I doing this right? But it's really to build our own awareness and be informed so that we can empower ourselves, to
Yeah.
really be connected with ourselves so that we can love our babies in really healthy ways and
Yes. I love
set
the
that.
title of the book, Love Me In. I know.
Yes,
Um,
yeah.
and just, I love your focus on conscious pregnancy.
Mm,
I think that needs to come back into
yeah,
focus. Being
yeah,
present and conscious. And can you
right.
talk a little bit about that? Conscious of what? Our thoughts, the energy we're bringing to this, conscious,
Yeah. I'm
enjoying.
gonna, sorry.
No, no, it's
We
okay.
could,
And
we could sit
about
in just,
enjoying pregnancy. I know there's not always joyful parts of pregnancy, but just how
right.
our thoughts and our feelings can
Mhm,
affect our little ones, right?
right. You know, my connection to conscious pregnancy really came through my occupational therapy work. And I worked in pediatrics for 35 years, but 10 of those years were in the neonatal intensive care unit. And so I was working with these very medically fragile and preterm babies, and they came into the world in a really difficult way and often very traumatic. And as I was working with these babies, different things happen. You know how we're on our own journeys and synchronicities happen and you hook up with the right people. Well, I connected with a woman by the name of Rita Clooney, and she's an amazing NICU nurse. And she developed the program called Healing Touch for Babies. And so I studied with her and hosted her program in Wisconsin years back and stayed in touch with her. But she started helping me really understand babies as energetic and conscious and aware and awake beings.
Mm,
And so that really informed the way I practiced in the NICU. And she eventually connected me to an organization called the Association of Pre and Perinatal Psychology and Health. And I want to read their vision statement because I love their vision statement. It says, every baby is welcomed, seen, and nurtured to their fullest expression as a conscious and aware being. So their whole study is on the consciousness of the baby, and that starts before conception, so preconception.
yeah.
But as I was working with these babies in the NICU, then from this, energy informed perspective and pre and perinatal informed perspective, these babies really started asking me to support them better, to come into the world with more ease and more love. And so I was in conversation with these babies through my work and through meditation. And I would say, well, what does that look like? How do we help you come in easier? And the answer was, to really offer more support to pregnant moms. And help them have more support in the mental and emotional and spiritual aspect so that we
Mhm.
can guide these beings in consciously as conscious beings. And so consciousness means us being as connected to our authentic self as much as we can.
Mhm.
Um, so,
That's so powerful.
yeah.
I heard you speak a few times and sharing some examples of the powerful work you experienced in the NICU. Can you
Yeah.
share a little bit, like how you
Uh,
you tuning into their energy? And I don't know if you
yeah.
read baby's chakras at all, if you were
Yeah.
doing that, but
Yeah.
you really helped, I mean, increase their biological functions, physiological functions, heart
Yeah.
rate, things, right?
Yeah, one of my favorite stories, and let me find a little piece I have on here. So it was a little 29-week premature baby, and the baby had a really healthy heart
At
and a really
29
healthy
weeks,
brain.
premature, sorry, I cut out for just a second.
29-week premature baby. Yeah, so baby was in an isolette, was on a respirator, feeding tube, IV lines. Um, but like I said, a healthy, strong heart and a healthy brain, but immature lungs, so just needed respiratory support. And so this was a baby that I was able to bring that energetic sense and the pre and perinatal principles to. And so I was standing bedside, watching this baby one morning, and the nurse was working with him, and he kept dropping his oxygen saturation. And so the nurse did all of her physical trained things. She repositioned the baby and she repositioned the tubes and she turned up oxygen and went through all this protocol about the physical being of the baby, and yet the baby wasn't responding. He wasn't bringing his O2 sats up at all. And I
Mhm.
was just standing and watching and observing this, and the nurse knew me well, and she knew some of my expanded practice model and knew that I brought some energy work into the unit. And so she had asked if I would, she called it, would I put my hands on him and give him some of my juice? That's how she talks about it. So
Magic.
magic, yes. And that's it's this double-edged sword for me. I loved what I was able to bring and do this beautiful work, and yet there still is not enough openness to have the deeper conversations about what this more expanded practice looks like in the NICU and what we're
Wow.
really doing. So anyway, so I worked with this little 29-weeker, and I always talk to them and I ask permission and I let them know what I'm doing, and I opened his little portals for his isolette, and I put my hands on him and was reading his energy and just where he was at in his chakra system. And babies have these wide open crown chakras, which is,
Mhm.
the top energy center of your
Right.
head and the crown of
Yep.
your head. And he just kept going out of his crown and going back to spirit world because it was safer and much more comfortable to him there. And so I put my hands on him and did some talking with him about where he was at. And when I put my hands on him, his O2 sats popped up within 3 seconds. And the nurse just looked at me and she's like, well, how did you do that? I repositioned him and did all my stuff too. But she was using physical body informed practice. And I was using this whole mental, emotional, energetic, spiritual informed practice. So I want to read this little poem. So I wrote stories and poems of some of these babies that I worked with, and this is called "It's Not a Comfortable Place Here." And this is from the voice of the little 29-weeker.
Okay.
And he says, "It's not a comfortable place here, coming in from the vast expanse of spirit world and squeezing into a tiny 29-week premature physical body. The space is limited inside the isolette. A breathing tube is in my mouth. So much restriction. It's not a comfortable place here. I like it better when I go back and visit spirit world, but when I leave my body too much, my oxygen saturation drops and the nurse gets concerned. It's not a comfortable place here. The nurse repositions me, checks my tube connections, and turns up my oxygen levels. And still, my oxygen saturation keeps dropping. It's not a comfortable place here. The nurse asked the occupational therapist to put her hands on me to give me some juice. Her hands feel warm and loving and present. I come back into my body. My oxygen saturation immediately improves. The nurse is happy. It feels a little more comfortable here. The occupational therapist says, it's your choice. You can stay or you can go back. Permission is given for a conscious choice. I feel seen and heard and understood. I choose to stay.
Wow.
I'm finding love and compassion here. It's becoming a more comfortable place here.
That's so powerful.
Yeah, so that's the passion of what working with this consciousness around mental and emotional and spiritual health and consciousness can look like for these little ones. And then if you bring the expecting parents on board so that they're reconnected with their own consciousness, it's powerful work.
Oh my goodness, yes. And you're helping me, you're reminding everyone, like, it's a choosing too, right? When we're given permission
Yes.
to have an open, the opportunity, just to, you acknowledge him feeling, seeing, hearing, and he chose. And so with moms and women who want to become moms too, it's really creating space, helping them choose the path that's aligned and that soulful approach. So
Right. And there's different paths for all of us. So there's different paths, as you know, of how to conceive.
yeah,
There's different paths of what's the right birth model for us.
right.
For some of us, a hospital birth is the best birth. For some of us, a home birth is the right answer. For some of us, a medicated birth is the right answer. And yet, we've been taught as women, I think, that, if you have an unnatural conception, you failed, or if you didn't accomplish your home birth, you failed, or if you had a medical birth, you failed. And so those are some of the deep mindsets we need to look at. We're not failing. There's a lot of different ways to do it. And, to be conscious is to work with that baby that's coming in. And what is the way that works for you and that mom and partner of coming in together? There's not a right or a wrong.
Totally.
Yeah.
I was just thinking about women who do go through fertility challenges. There's a lot of, it becomes almost this trauma that a lot of women adopt and think that it has to continue limiting them in their life.
Right.
I believe that it never really leaves you. It's always kind of a part of you, but it doesn't have to be the dominant story that's guiding us.
Right.
And so there's just so many women I see that have the constant fears, the worry, the anxiety while going through fertility treatments. And what are your thoughts around those affecting their womb space and when you go through, I'm sorry, yeah, I don't know. I'm just kind of curious what your thoughts are on that.
Right. It's interesting. And, I think there's a fine line of, not wanting to judge somebody or shame somebody because of their thoughts. You don't want to impact more trauma. We want to always empower, right?
Right.
But I think the middle ground is just to have awareness of our thoughts and just the knowing of it so that we can be present with that.
Yeah.
So, there's some really fascinating leading edge research out there that even says that baby is starting to be imprinted 2 months before conception, with the emotions and the mindsets and the hormones of where that egg and sperm come from. And by the second cell division, that egg implants in the uterine wall, and that cell is already innately deciding one of two paths to take. It decides, do I build the wiring and the network to thrive in life and have a really strong frontal lobe and executive functions and different organs set up? Or do I know that I'm going to really have to work to survive in life?
Mm,
And so then I might have a stronger network in my hindbrain or some bigger adrenal glands that can boost stress hormones in a better way. So I don't think that, there's a negative about don't have those mindsets, but let's just have awareness so that we can empower ourselves and know that we can make a different impact if we choose to just shift our perception around our story.
mhm.
And I think that that's really
Are you?
important. Just what's our perception around our story? And
Mhm.
trauma has different stages. There's the trauma, there's surviving the trauma, and then there's thriving. And so it's a process.
Wow.
And I think we have to be gentle with ourselves and just honor where we're at. There's some really good practices. I teach a practice called a differentiation exercise. And I learned it from one of my pre and perinatal psychology mentors, Kate White. And it's this process of when baby's in utero and you're experiencing stress as the mom, and we know that that stress downloads to the fetus, but we use this tool of differentiating. And so we can just be aware of the
Mm,
stress and have consciousness of that and
mhm,
talk to the baby and say, I know that was really stressful. I have a lot of stress right now. It's not your stress. It's not
mhm.
about you. This is just mama's stress. You're okay. You're safe. You're loved. And so just differentiating for the
Validating,
baby.
express, and do you have them express it verbally or more like internally?
Either way, it works either way, whatever the mom is comfortable
Yeah.
with. Yeah. I
And so,
remember this one story. I was working at an outpatient pediatric clinic once, and I was supervising a COTA, and she was several months pregnant, and she was having a session with a child that had a really difficult family dynamic that was in the middle of a really challenging divorce. And the mother and the paternal grandmother were at the session, and there was a really significant altercation at the end between the grandma and
the
the
mother.
mother of the child. And the therapist she was so stressed out. I mean, she was just in tears, at one point. And I remember I was sitting at my desk kind of watching this and deciding if I should intervene. And what I was asked to do was to intervene for the baby in utero. And I did a differentiation exercise with that baby in utero and just sorted out the stress for that baby and cleared some of the energy around that for that baby in utero. So just really powerful.
That is so powerful. A lot of people probably are wondering, how does all this energy really work?
Yeah,
We
yeah,
can go really deep, but as you know, we've talked off camera, I was doing like Reiki treatments as I was going through trying to conceive, going through IVF treatment, pregnancy, and I like to think our daughter, she was such a calm baby, and I think that had a big part of contributing to her ability just in her nervous system and feeling safe, and just she was able to self-regulate really well. And
yes,
it does start with kind of us and the mother, and
right, right,
um,
right. So how are you regulating yourself even prior to conception and during pregnancy? Because all of that is being taught to baby in utero.
right, the emotions that we're feeling. And
Yeah.
yeah,
Yes.
you and I both agree, feeling joy during this process, but also feeling all the range of emotions. Like, I'm not talking
Right.
about sweeping things under the rug, like being self-aware,
Yes.
letting things move through us. But yeah, thank you for sharing the data. And you and I have talked off camera about that. Like, it's such a fascinating
Yeah.
study with the work with, going through IVF, we see these embryos, they watch it
Yes.
dividing as cells, two cells, five
Mhm.
cells, 10, they just, we have pictures of our little blastocysts,
Right.
and
Right.
at that level, they have this consciousness that already is formed within them.
It is. It
being
is.
the embryo, not being, I don't know. I don't know the words to use, but
Yeah. One thing I have in my book, Lisa, and it's a practice for expecting parents to use, but it's based on Dr. Amato's work, healing energy and the power of speaking positive thoughts to water molecules.
oh, cool.
And as you spoke love and harmony and beauty, he had pictures of if you spoke negative thoughts and if you spoke positive thoughts, and the beautiful crystal, how the crystals align, they organize and align with harmony and beauty. And so it made me think of the fertilized egg, in the little petri dish, and just that watery environment. And
Oh my
what if we spent more time, imprinting
God.
divine qualities even at that stage? And when a fertilized egg is implanted, it's 90% water. It's mostly water molecules.
Oh my, that's just, I'm thinking about, oh my goodness, that's a whole new industry to like support the embryologists. We're doing energy
Right,
work in the lab,
right, right.
helping the embryos come along. I've got a lot
Oh,
of clients who are
yes,
waiting to hear the results of their embryos and how they're progressing and how are they going to make it? Are they
right.
thriving? Is one coming along?
Yes.
There's a whole, oh my goodness, that's
That
interesting.
gives me goosebumps. Oh my gosh, the amazing things that could happen
Combining
with
the
that.
medical and the spiritual, right? I mean,
Yeah,
if clinics are open to that kind of stuff, this is really powerful work.
right, right.
Yeah, talk about your book. I love, thank you for sharing that exercise
Oh,
book and that study and the visualization. Yeah, mantras are powerful, all of that. I'm so glad you're incorporating that in your book, like what we're
yeah,
thinking, saying, but yeah.
right. Yeah, so my book is called Love Me In, a Sacred Pregnancy Journal. And it's kind of that dual title that, it's about loving ourselves in as moms so that we're connected with our heart space
Yeah.
and can consciously love that baby in. And it's just this beautiful um, journey experience of guiding expectant parents, through preconception to conception to there's a section called watering the womb environment and some nice practices for in there, and a
Mhm.
whole section on bonding and knowing what sensory systems are coming in at what time and how to bond with your baby in utero to set up that whole postnatal bonding session. So it's
So
just there's lovely, I had a woman do just beautiful watercolor illustrations. So there's like healing art therapy in it. There's
mhm.
journaling prompts. There's meditation exercises.
Yeah, I know you
Yeah,
guide women in different meditations, which I love to do that another day.
yeah,
Guide
yeah,
women through some powerful, like I know you did one on the heart. I
yeah,
am, what did you call it? I am heart. But yeah, your book sounds so amazing. I can't wait to read it.
yeah. So it's a little bit different than what's out there. It's not a big knowledge, physical body informed book about diet and exercise and the external. I think we were talking about this in a conversation. It's not that external focus. We spend a lot of time on our physical body, which is important, and there's other pieces. And we
Hmm.
spend a lot of time as new moms of how do we want to design and create that nursery, with
And
what
nursery in
crib
our
do we
womb
want?
space.
Yeah, but what about the nursery of our womb space? So it's a book about supporting that whole womb space. And
I love that.
yeah,
Gosh, I can't wait to read that. You're so right, though. It does. Like so many women are focused on the external, the
yes,
nursery or all of the baby items, or
right.
but let's pull it back into
Yeah.
ourselves.
I was coaching a woman once in some of my pregnancy coaching work, and it was her first baby, and she was getting a little anxious. She was about a month out, and we were on a call, and she's like, "Well, I have this whole list on it. Like I've got to clean out my refrigerator and clean the bathroom floors one last time. Like all this list of physical tasks to do." And I said, "Well." I said, life is going to keep going on, so what if that refrigerator is cleaned
Yeah.
out right now or not? And we shifted her focus back to bring it back internal again in that last month of pregnancy.
Mm,
And her husband ended up going and doing a nice weekend retreat. And they did some of the meditation practices I taught them. And she just wrote this lovely testimonial about that, and just what a beautiful experience that they had together, just connecting and bonding with that baby in the last stages of pregnancy, and
Mm,
setting all their energies up to get ready and prepare for birth and bringing that baby earthside. So just a whole different focus than all that external busyness we can put our energy into.
that's so wonderful. Yeah, just those simple practices and reminders, and
Yeah.
embracing the journey, embracing this ride.
And she said her husband just really appreciated it, to be invited into that inner journey too, instead of just the man who has to do the honey-do list all the time.
Right.
So yeah, she said it was
So,
just a beautiful experience.
have you had any, just because we're recording this during the time of COVID, yesterday was
Oh,
the 1 year anniversary. I'll be
yeah.
released a
Yeah.
little bit after that. But just all these women who are looking to become mothers and going through fertility treatments, and like some of the most powerful women, like I know, right? Just these warrior women, and having gone through fertility treatments, I know what a long road that can be, an IVF,
Mm,
and even to go through it during a pandemic when they've
right.
had challenges and setbacks and all kinds of things. It's like, and you're women that are pregnant that you work with. It's just, any thoughts about that? Like what we're living through?
Oh my gosh. Yeah, let me say a couple different things. There are some interesting studies coming out just about, the increased stress with moms during COVID and the disconnect from connection. I mean, they're just not receiving the same support and hospital childbirth class services even that
Oh,
typically they would.
oh
So
yeah.
there's that piece. I think I shared with you a study too that was recently done in a couple Eastern countries, but they were doing a study on spiritual health and how the woman's spiritual focus has decreased during COVID. And as their spiritual health has decreased, their mental and emotional health has also decreased.
Mm,
And we know that mental and emotional and spiritual health are important for the development of the baby, but also for the mom's own mental health. I mean, we have statistics of 1 in 7 moms experiences postpartum depression. Those are high numbers, even as developed as a country as we are. And with all of our technology and birthing practices that we have, it's saying we're
mhm.
we're still missing something about mental and emotional and spiritual health for our moms.
Yeah.
And then with COVID, that's even a bigger struggle for expecting moms right now. I was coaching a woman, it was last April and May. No, it was before that. It was about this time a year ago because she was due in April. So
Mm,
she was living in New York at this time of February and March, and New York was the epicenter of COVID
yeah.
at the time a year ago. And she was checking in with her hospital where she was delivering, and they put in a no spouse, no doula, no partner, nobody being present with you during delivery. And she was like, I can't do that. And so she ended up relocating for the last part of her pregnancy and birth back to Wisconsin where she had family. So talk about being a warrior, and just what
Yeah.
you all had to take on during COVID with pregnancy and birth and delivery. And she ended up coming back to Wisconsin, but, was looking for an OB then, at the tail end of her pregnancy, and ended up hooking with somebody, then you have to deal with insurance and all those pieces. And she
Goodness.
ended up hooking up with an OB who, the first thing she said to her without even knowing her or her pregnancy history is, well, 50% of pregnancies end up with a C-section. And it's like 50%, that's just not even true. So she
Gosh.
just had to constantly keep dealing with all of these external
Wow.
stressors coming at her. And yet I taught her quite a bit of meditation to work with. So she just kept finding her center and going back to her inner truth. And
Beautiful.
um, labor and delivery was not as smooth as she would have liked. She ended up having a C-section. And
Mhm.
again, having to work with her after the birth even, and just go back to, you had the best birth during this period that you
Yeah.
could have had. You know, you were this warrior who dealt with some really big roadblocks along the way, and she kept staying in her center with it, even, you know, despite it not being her ideal pregnancy and birth. And so she kept imprinting those positive imprints to her baby,
Mhm.
even during the stress and trauma.
That's wonderful. Yeah, I was just thinking about how we've talked about birth stories. What a birth story
Right?
that she's lived and she's going to be sharing with her little one day. Like you could have been born in New York, but you were born in Wisconsin.
Right, right,
Like we all have
right.
this path of how, and just being open. I think, do you have any kind of tips or things you would encourage moms to embrace as they are looking to take on a more kind of open, spiritual minded approach and to give their baby the best imprinting they can?
Right. You know, I think for moms, you know, we carry so much weight and so much stress, and we are trained to take care of everything and everybody around us first, you know. So the first thing is to give yourself permission to do some good self-cares for yourself. I mean, it's so important.
Yeah.
You know, spend some time for yourself a little bit every day, even if it's just for a couple minutes of sitting in a chair or just consciously having, you know, a cup of tea or going for a conscious walk,
Mhm. Mhm.
and not being so hard on yourselves, you know. um
Yeah. I think it's, yeah, bringing it back to the present.
yes, yes, just being in the present, relaxing our expectations a little bit and our attachments to outcomes.
Yeah, that for sure.
I was recently talking to a brand new expecting mom, and she was just finding out she was pregnant and wasn't even convinced she was pregnant. And I was on a call with her, and I was trying to sort out, you know, where her mindsets were, and where she was getting tripped up. And she was saying, I don't feel pregnant in my body. She was stuck on that. I don't feel pregnant in my body. And we were talking about some of her menstrual cycle symptoms and where she was at in her cycle, and um, you know, what she was experiencing, and was she just late or was she pregnant? I was trying to sort all of that out with
Mhm.
her, and she kept coming back, but I don't feel like I'm pregnant. And I finally just stopped and I said, did you do a pregnancy test? Do you know yourself to be pregnant? And she said, well, I've done 4 pregnancy tests. And I said, oh, well, what was the result? And she said, they're all positive. And so I went back and I said, okay, so why are you not trusting that you're pregnant? And she said, well, my mom always said she knew exactly when she was pregnant. So she had this attachment to this mindset of, if I'm doing it right and if I'm healthy, I would know and feel in my body that I'm pregnant. So she had herself setting up for failure already. So we
Wow.
talked about that. And, you know, you said, what's a tip, you know, for pregnant moms? It's even just being aware of your thoughts and what's underneath your thoughts, so that you can
Yeah.
just let go of some of that deeper
I think that
fear
goes
and
for whether
failure.
you're pregnant or you're not pregnant too. Those like trying to become a mother. I encourage
Yeah,
my clients too to let go of any outcome, setting the timeline.
right,
We don't know
right.
the timeline,
Yeah,
right? There's a lot that goes into it, but
right, right.
um,
And it's easier said than done. I
yeah,
I coach people like that too, and then I get in my own life situation, and it's like, where's my patience with that? And I have to keep coming back to my center
yeah. Well,
and
I love that
trusting.
we share such similar lines of work, and I will definitely be sending more people your way because I love the work you're doing, and
Uh,
you know, it's so
Thank
powerful.
you.
How can people find you?
You know, I've got a website, www.donnaseegersabler.com.
Yep, I will link it in the note.
Yeah, so they can find me through my website. I have some classes on there. I
Yeah.
have,
I wanted you to
yeah,
share a little bit about you have classes on oh my goodness, the calm birth prenatal meditation classes. I think you have some coming up in April, don't you?
I do. Yeah, let me think. I have, oh, April 13th, I
Yeah.
have a free intro class coming up on calm birth prenatal meditation classes. And
Okay,
that will be, yeah, that will be on Zoom. And then the class series starts on April 20th.
that's so
So yeah,
link your website, and you offer a lot of different services, different, like I said, pregnancy coaching and
yeah,
infant massage even, which we didn't even jump into, but advanced energy therapy. And
yes,
I love all that
yeah,
you're doing.
yeah.
Here
And
for the Soul
I
Sister.
have I've got a great little book trailer out
Oh
there on my
yes, your book,
website.
Love Me In, and
Yeah.
it's going to be available how soon?
Oh, within the month. I think
Okay.
we should be launching within the month. So watch
Okay.
my website for that. If you sign up for my newsletter, I'll certainly
Yeah, I'll help you
be
get the word
putting,
out about that for sure. So,
yeah, yeah, I'm
all
excited
right.
about it.
Lots of love to you, Donna. Thank you.
Yeah, you too.
And
Thank you
for
so
everyone
much, Lisa.
listening, yeah, there's lots of other interviews over on my YouTube channel. Lisa White, IVF Manifesting a Miracle. You can find Soul Sister conversations like these and clinical conversations I do with my fertility doctor, here to help support you on your fertility journey and feel empowered and confident, calm. We're all here to help you. So reach out. All right. Thank you, everybody.
Yeah, thanks, guys. Lots of love to all those people out there trying to get pregnant or being pregnant. We're
Yes.
thinking of you.
Bye.
Bye-bye. Thanks, Lisa.